As well as the recent well-published links to a higher incidence of cancer and also diabetes, heavy snorers or sufferers from sleep apnea have now been linked to a significant increase in the risk of autoimmune disorders, where the body attacks healthy tissues. A new study now shows that heavy snoring almost doubles the risk of developing rheumatoid arthritis. Researchers found that patients diagnosed with the snoring-related condition sleep apnea were nearly twice as likely to suffer the joint-damaging disease. The discovery, which comes from research carried out in the Far East, is something of a surprise, as rheumatoid arthritis, which affects around 350,000 people in the UK, is thought only to be triggered when something actually goes fundamentally wrong with the immune system. At risk are an estimated 3 million people in Britain alone who suffer with sleep apnea, though many, many more may remain undiagnosed. The same study found a similar increase in the risk of other so-called autoimmune disorders, where the body's defences start to attack healthy tissues. Scientists say they believe the explanation lies in the fact that chronic sleep apnea can lead to inflammation in blood vessels throughout the body, which may act as a catalyst for arthritis. Although previous studies have suggested sleep apnea may raise the risk of heart attacks, the latest investigation is the first to show a link with arthritis. An estimated 3 million people in Britain suffer with sleep apnea, though many more remain undiagnosed. As far as beating arthritis is concerned, it is all in the head. Pain of joint condition can be erased through counselling. As sleep begins, the muscles in the airway tend to relax. For most people this does not pose a problem, but in sleep apnea it leads to a complete collapse that shuts off breathing for at least 10 seconds. It also disrupts breathing and triggers the sound of snoring as air vibrates against the soft tissue that stands in its way. Once the brain realises breathing has stopped, it sends out a signal for the airway muscles to contract again, which opens the airway, and the sufferer normally wakes with a jolt. In mild sleep apnea, this can happen about once every 10 minutes. If it's severe, it means sleep can be disturbed every couple of minutes. Very few people remember waking up at all because they fall asleep again within seconds. Yet the cumulative effect is that they feel exhausted during the day, putting them at risk of accidents. In this latest study, by experts at a specialist medical university, 1,411 sleep apnea patients were compared to a 7,000-strong group of healthy adults. Over a 5-year period, researchers monitored how many in each group went on to develop rheumatoid arthritis, spondylitis, and other associated conditions. All conditions where the immune system goes haywire and causes swollen, painful joints and flu-like symptoms. These results have recently been published in the journal Sleep Medicine and show the snoring-affected group were 91% more likely to develop one of the 3 conditions. However, the researchers stressed that the absolute risk of falling ill was still small. Out of the snoring patients, only 2.91% experienced arthritis-related problems. In a report on their findings, the researchers said, "This study is the first to investigate the association between sleep apnea and the development of autoimmune diseases. This may have gone unnoticed in clinical settings because these cases are relatively rare and may not be reported. But the potential link between these 2 conditions should not be overlooked. Among the diseases we studied, rheumatoid arthritis had the highest risk of developing sleep apnea patients." As well as inflamed and swollen joints, arthritis sufferers also experience flu-like symptoms. In very severe cases, they can end up crippled and unable to live a full life. But diagnosing the condition can be difficult, as the early signs can be as innocuous as a slight stiffness in hand joints, often early in the morning. Believe it or not, the best person to treat your snoring and sleep apnea is your dentist. There are several effective treatments that can open up your airway while you sleep, so as to eliminate snoring and correct issues associated with sleep apnea. But the first step in your treatment is a proper diagnosis of your condition, which often requires participation in a sleep study. From that point, you'll find that the most common treatment for snoring and sleep apnea is oral appliance therapy, custom-fit devices to be worn at night that prevent airway obstruction and allow you to breathe easily while you sleep, otherwise referred to as MADs, splints, or mouthpieces.